Hello and welcome to your OB course. Right now we're going to be talking about infertility and implications of infertility. So first and foremost, let's talk about the male factors related to infertility. But before we even get into that, let's talk about what infertility is. By definition, it is the inability to conceive and maintain a pregnancy after 12 months of having unprotected intercourse, okay, unprotected sex. Um, However, if a female is older than 35 years of age and they have been trying to conceive for more than 6 months, then they're also categorized or defined as, this is also categorized as infertility. So 12 months of trying if you are not 35 yet, or 6 months if you are 35 years or older. It affects 12% of women ages 15 to 44, according to the CDC. And it's important to remember that infertility affects physical, social, psychological, sexual, and economic dimensions of a couple's life. All right. When we, historically, people, I remember as a child myself, if a woman was not getting pregnant, it was always her fault. There was something wrong with the woman. Today, we know that that is not the case. And we'll see a little bit about that as we continue with this session. In the male, what are some of the causes of infertility? Okay, a cause can be identified in approximately 80% of couples who have experienced infertility. In the case of males, some of the factors are endocrine issues such as pituitary disease, tumors, hypothalamic diseases that interfere with male fertility and can cause low levels of LH, FSH, testosterone, or decreased sperm production, okay? Which leads us to spermatogenesis. Spermatogenesis is basically the formation of mature functional sperm, right? There are several factors that can affect the formation of mature sperm. That is the key. These are called gonadotoxins, and they include drugs such as chemotherapeutic agents, calcium channel blockers, heroin, and alcohol. Another gonadotoxin are infections and viruses. Okay, sexually transmitted infections. Okay, contracting mumps after puberty is one of the gonadotoxins. Systemic illnesses, prolonged heat exposure to the testicles. So, frequent use of hot tubs, wearing tight underwear, maybe bicycling, frequently for extended periods of times, exposure to pesticides, and then, of course, radiation to the pelvic region. We also have what we call sperm antibodies. This is basically antibodies are an immunological reaction that causes a decrease in sperm motility. This can be seen in men who've either had a vasectomy reversal or who have experienced some type of testicular trauma. Then infertility in males can also be caused by sperm transport issues. All right, and this occurs when the male reproductive anatomy interferes with the sperm transport. Again, because of a vasectomy, inguinal hernia, or congenital absence of the vas deferens. There's also disorders of intercourse, which include erectile dysfunction, ejaculatory dysfunction, anatomical abnormalities, and of course, psychosocial factors, which can also interfere with fertility in a couple. In the female, infertility issues are classified into three major categories: ovulatory dysfunction, tubal or pelvic pathology factors, and cervical mucus factors. Okay, so with ovulatory dysfunctions, it refers to hormonal imbalances, hyper or hypothyroidism, high prolactin levels, premature ovarian failure, or basically menopause prior to the age of 40, and PCOS, or polycystic ovarian syndrome, which we're going to talk about in another session. When we refer to tubal and pelvic pathology factors, they include the damage to the actual fallopian tubes and when a woman has uterine fibroids. Damage to the fallopian tubes is generally related to previous pelvic inflammatory disease or endometriosis, and then uterine fibroids, which are benign growths on the muscular wall of the uterus, can cause narrowing of the uterine cavity, and then they interfere with embryonic and fetal development. Okay, so they lead, a lot of times they can cause spontaneous abortions. With cervical factors, mucus factors, they include infection and cervical surgery, such as cryotherapy, okay, which is a medical intervention to treat cervical dysplasia. So all these factors can interfere with the ability of the sperm to enter or survive in the uterus. All right, and we have lovely pictures here of what that looks like. Other risk factors in women are autoimmune disorders, diabetes, eating disorders. When you have women who suffer with anorexia or bulimia that are extremely, extremely thin, their hormones are completely off and they are not able to get pregnant. The same thing occurs in women who are very heavy, who are obese, okay? Women who consume an excessive amount of alcohol or excessive exercise. Cancer treatments can also cause infertility. And then, of course, age. After the age of 35, it's harder to conceive. And then STIs. In the males, you have, and I think we discussed this a little bit, environmental pollutants, drug use, impotence, age, and also STIs. Smoking is another one that I did not put here, but I guess it's part under drugs. Smoking is another factor that can increase the risk for infertility in males. How do we diagnose infertility? There's multiple ways, and this is what I was talking about when I said that back when I was a child. I remember if a woman was not conceiving or was not getting pregnant, it was her fault. It was always the fault. I never heard anybody say that it was, that it was the fault of the significant other, the male in the relationship. Now we know that they share the load. You have 40% female factors, 40% male factors, and 10% it's unexplained. We don't know why it occurs. And then the other 10%, it's a combination of male-female factors. So how do we diagnose infertility? One of the ways is through semen analysis. Why do we do this? This is most of the time, this is the first thing that they do. And the reason being is because it's one of the easiest tests to perform. If it is the male, they can, easily assess that. We also have an ovulatory dysfunction analysis, which includes taking the basal body temperature and charting it. The female partner has to take her temperature every single morning before getting out of bed using a basal thermometer, and then they have to record this temperature. Ovulation has occurred if there is a rise in temperature by 0.4 degrees Fahrenheit for 3 consecutive days. So this is a lot of work, okay? Fortunately, we now have ovulatory prediction kits, ovarian reserve testing, detecting LH surge, etc. Other ways to make it a little easier. We have what we call an endometrial biopsy. This is performed to assess the response of the uterus to hormone signals that occur during the cycle. The biopsy is performed at the end of the menstrual cycle in a clinic or a medical office. And then we have a hysterosalpingogram. And it's basically a radiological examination, and it provides information about endocervical canal, uterine cavity, the fallopian tubes, to make sure that everything is as it should be. Under fluoroscopic observation, the dye is injected through the cervical canal into the uterus, and then the examination can detect if there's any adhesions or occlusions or uterine abnormalities like uterine fibroids or a bicornate uterus, or any uterine fistulas. We also have laparoscopy. Laparoscopy uses a laparoscope to visualize and inspect the ovaries, the fallopian tubes, and basically all the structures to see if there are any abnormalities such as endometriosis or scarring. Then treatment. How do we treat infertility? There is multiple treatments available, okay? For the male, Treatments can include hormonal therapy for endocrine factors, lifestyle changes. For example, if they're smoking, they have to stop smoking. You want to improve nutrition, decrease stress. They can utilize corticosteroids to decrease the production of sperm antibodies, antibiotics if they have any type of GI tract infections, reparation of varicocele or inguinal hernias to facilitate transport of the sperm, and transurethral resection of ejaculatory ducts to treat disorders related to intercourse. Right? With the female, some of the treatments, again, also lifestyle changes, drug therapy to stimulate ovulation. This is very important, very commonly used. One of the medications is called clomiphene citrate, also known as Clomid. Has a very high success rate, okay? And again, the indication is for anovulatory infertility. So women who have trouble with ovulating, okay? It stimulates FSH and LH, and then in turn, it stimulates ovulation. It can cause hot flashes, breast discomfort, headaches, insomnia, bloating, blurry vision, nausea, and vaginal dryness. It's generally taken PO by mouth, 50 to 200 milligrams a day from cycle day 3 to 7, right? You as a nurse, your role is to provide information on the medication and the possible side effects, okay? The woman is not to drive if she is experiencing blurry vision. Another thing that we do as well is surgery to open up fallopian tubes if there's any abnormalities or any occlusions of any sort. Removal of uterine fibroids, known as a myomectomy. And then, of course, antibiotics to treat any type of infection. Then we also have what we call assisted fertility technologies. What this refers to is the use of things such as artificial insemination, whether it's intracervical, intrauterine, utilizing the partner's sperm or a donor sperm, different methodologies that are utilized in order to achieve pregnancy, okay, to conceive a child. For example, fertility conditions where these procedures would be used are when women have poor cervical mucus production as a result of previous surgeries, or anti-sperm antibodies in the male, diminished amount of sperms, and diminished sperm motility. Okay, so we would use these assisted fertility technologies. We also have what we call testicular sperm aspiration. This is basically a procedure that aspirates or extracts directly from the testicles, generally utilized when a man has had unsuccessful vasectomy reversal or when they have an extremely low sperm count, okay, or have an absence of vas deferens, okay. Then we have in vitro, which I think a lot of people are familiar with, and this is where the oocytes are harvested and fertilization occurs outside of the body in a lab. So there's different things that can occur. Gift. With a gift, the sperm and the eggs are placed in the fallopian tube to allow fertilization to occur in the natural site, right? And then the woman must have at least one normal open fallopian tube for this to be able to function. So what are the implications of assisted fertility technologies or assisted reproductive technologies? Okay. A lot of these things can be controversial in many religions or cultures. Basically, what happens is that people wonder, okay, when you have a surplus of embryos, because when these things are done, when you are utilizing art or assisted reproductive technologies, they generally create or have multiple embryos, okay, those produced from hyperstimulation of the ovaries that occur when IVF technologies are used. Several eggs of the woman may be harvested and fertilized using IVF, but then you'll only pick 2 or 3 to return to the woman's body. So this has caused ethical conflict or issues. So many people say, when does life begin? Is it right, when the embryo, or is it when They have a heartbeat. When does it occur? So this is obviously something that, again, it's controversial and to each his own. But they'll ask questions, other ethical questions such as who owns the embryo? Does it belong to the woman or to the man? Who decides what's gonna happen to the surplus of embryos? Who has access to assisted reproductive technologies? All right, given that they're very costly and not covered by health insurance providers, often not covered by health insurance providers. Okay, so at what point should the healthcare provider recommend that the couple stop using assisted reproductive technologies? All right, so those are ethical implications of art, right? We also have the emotional implications, not only of art, but of infertility in general. Couples who are dealing with infertility are basically on an emotional roller coaster, okay? And they experience a lot of stress, anxiety, and depression, not just the female, but the male as well. They can experience guilt if one of the partners is the responsible one or has issues with infertility. They feel guilty, they blame themselves for their inability to conceive. It, of course, places a lot of marital strain if the other partner blames the other for infertility. It can cause sexual dysfunction because of the amount of stress that it causes. And then, of course, it causes strain with the extended family. So the couples may avoid family get togethers because they're constantly being asked, oh, so when are you having a baby? When are you guys going to have a kid? And nobody really knows because this is a private matter, what is going on. Many times people have a lack of support, and particularly those who maybe don't have the funds to even look into assisted reproductive technologies. Most couples in this case can benefit from counseling from the time of diagnosis, okay? And then counseling includes discussions about the effects of the treatment, information about the different treatments, the effects and consequences of resolution of treatment, decisions of when to stop. How many in vitros should you have? 1, 2, 3, and I guess it can also depend on the amount of resources that you have. Is adoption an option? All right. Many people are quick to say, well, why don't you just adopt a baby? Like it's so simple. And not only is it not simple, but most people want their own biological children. And then, of course, the use of surrogacy, which is an option for a woman with unhealthy or no eggs. This is when another woman is impregnated with the partner's sperm and she carries the baby on behalf of the couple. And then we also have what we know as a gestational carrier. So the woman uses her own egg and her partner's sperm and places it inside the uterus of a carrier who basically agrees, acts like an incubator, to carry the baby on behalf of the couple, and it is not biologically related to the carrier in any way, shape, or form. So lots of information. Again, I hope this spikes your curiosity to go do some more research on all these very interesting topics. See you next time.